We'll see if it comes out on here. Does it say that it's live?
Mm-hmm.
It does? Really? Okay, so maybe it's working. All right, so hi, I'm Dr. Pete, doing live from Family Medicine of Pooler. And if you're wondering where Family Medicine of Pooler is, it's in the name. We're in Pooler, Georgia, which is a suburb of Savannah, Georgia. And we are the first direct primary care practice in Savannah area. There are more to come, but we are the first ones that started January 1st. So you're probably wondering what direct primary care is. What it is, just to simplify it, it is a where we don't accept insurance. Instead, we do a low monthly fee, which is anywhere from $10 to $100 a month, depending on your age, and it includes pretty much everything that you need in for direct primary care. I mean, for primary care. So that includes office visits, in-house labs, in-house procedures, things like that, and it's all included in your price. Also, telemedicine is included, even house calls if needed. So we try to make it a small package, and the way that we do that is by eliminating the insurance companies. So we are going to do a little tour of the office for a couple minutes, and we hope you'll join us and ask your questions online. So if you will come with me, we're going to walk through the office. So we are just going to the front waiting room.
Yes, ma'am. You'll probably have to have that as well.
As you can see here, our waiting room is absolutely empty. The way that this is possible, this is always empty. You can stop by here anytime and you can see we're empty. Is it because we have no patients and we're making no money and we're going to go broke? No. It's because we have switched over to direct primary care. Just last month in December, we were taking regular patients with insurance, and we had a pretty full schedule. We had to see patients every 7.5 to 15 minutes and then be done. That was their requirement of us. Now we can take as long as we want with patients, and we've been able to reduce our patient load from 3,000 to 600. And by doing that, we have an open schedule. You need to come in, you just give us a call, we'd probably be able to see you right away. This is anytime. This is Erin. She works up front, and she is happy to answer your calls. Okay. All right, so we'll be going into the back. Meet some of the nurses too. Can you check on Facebook if this is live? Come on in. And then here we have our nurses, Tiffany and Kelly.
Hello.
So Tiffany, I had a question for you.
Yes.
What was it that you were working on? Was it medications? We just did our first.
Yes, we prescribed our first medication today. It was for Prozac, 20 milligrams, a 90-day supply. The patient paid $3.06 compared to a pharmacy rate of $21 for a 90-day supply. So the patient saved $17 on her first 90-day prescription.
And you're probably wondering, how in the world can we do a 90-day prescription for only $3? And the answer is simple. We don't make any money off of it. One set. It's the cost that we get it for. So you can't find it cheaper, because if you went to Walmart, that's the price that they get it for. They're going to try to make something off of it. And so that's the way that we keep our prices so low. And then this is Kelly.
Hi.
And she is working on labs. Can you tell us something about the labs?
I can. Our basic CBC test that we usually run every 6 months or to a year is usually $30 or more through your insurance. Through us, it's $2.50. Also, people who have thyroid conditions, who have their thyroid checked normally, that test can be $50 or more through their insurance. For here, it's $4.50, so a huge savings on our labs.
Thank you. So you see that both of those labs, those are just examples. I mean, there's 100 labs that we probably do, but all of them are also at cost. We don't make any money off of that. That's it's sent out. Any of the in-house labs are actually free, which we didn't mention. So complete metabolic panels, A1C for diabetes, things like that we can do in-house, we do for free. The ones that we have to send out, like the ones that she just mentioned, are at the cost that the labs give to us, which is really wholesale. Okay, one more thing I want to show you. We're going to go into Dr. Christy Gallow's office, and she is in the process of doing our first telemedicine visit, which is video conference visit.
All right, and then we'll set you up for a month for another video conference, and I'll send you a text, and then
interrupt for a minute?
Absolutely. Is this a good time just to break and have you say hello to the world?
Okay, so you're going to come in here. All right, so we have Dr. Christy Gallup over here doing her first video conference.
On Cole.
On Cole. I didn't know if he wanted to mention his name. All right, with Cole, which is, how far away are you, Cole?
I'm in Augusta, Georgia right now.
Augusta, Georgia. So if you had to come in for an office visit, how long would that take you to drive over here?
It would take me right now about 2.5 hours to drive now.
So 2.5 hours each way, that's 5 hours that you would have spent driving over here. So you saved a lot of time. What are you going to do with that extra time?
Hopefully sleep or find something to do.
All right. So that's Cole. That's our first telemedicine patient. He's away at college, so he did not have to drive all the way over here and waste his time. Instead, we just did this video conference. So you're happy about this, I'm sure, right, Cole?
I'm super happy about this. It's so convenient.
Okay, awesome. Thank you. Appreciate it. So we'll just go back into my office so I can just wrap it up and see if there's any questions. Okay, so there you have it. Direct primary care, kind of in a nutshell there. I do not see any questions, but that's because I don't know how to use this. Yeah, I don't see any questions. All right, so, yes, I do. I see myself live. All right, anyway, so I'm glad that you guys joined us. We will probably try to do this a little bit more often so that you guys can get a feel of what this direct primary care thing is, because I know you guys, we've been getting a lot of questions about it, so I thought I'd do it live. So we look forward to seeing you in the future. Thanks for joining us.